12 signs of vitamin D deficiency. While the symptoms of low vitamin D levels differ from person to person, the obvious indicators include exhaustion and lethargy, poor bone health, and muscular weakness. Vitamin D insufficiency, on the other hand, can present in a variety of ways, and it is normally identified by a blood test rather than symptoms. Keep watching to learn about 14 indicators of vitamin D insufficiency that you may be experiencing, paying special attention if you are at an elevated risk of low vitamin D. People over the age of 65, those with darker skin or a malabsorption problem such as celiac disease, and those who get very little sun exposure are at a higher risk of vitamin D insufficiency. Number 1, tiredness and fatigue. Is a lack of vitamin D making you tired? Yes, studies have shown that there is a relationship between fatigue and vitamin D insufficiency, with persons with low levels of vitamin D seeing an improvement in their exhaustion when they take vitamin D supplements on a continuous basis. If you're experiencing inexplicable exhaustion, you should consult your doctor about getting a blood test to discover if your vitamin D levels are low. Number 3, poor bone health. Vitamin D aids your body's absorption of calcium and phosphorus from meals, both of which are essential minerals for bone health. Decreased vitamin D levels can result in low bone mass and bone discomfort. Vitamin D deficiency may also raise the risk of osteomalacia and osteoporosis, both of which increase the likelihood of fractures and breaks in your bones. Number 4, dry skin conditions. According to studies, persons who are deficient in vitamin D have dry skin that is prone to eczema and psoriasis. This might be related to a possible relationship between vitamin D and skin moisture. One study discovered that people with low vitamin D levels had lower average skin moisture than those with normal vitamin D levels. Eczema and psoriasis are widespread skin illnesses, and many individuals suffer from dry skin throughout the fall and winter months. Therefore, these problems may not be caused by a lack of vitamin D. If you're concerned about your dry skin and feel you may be deficient in vitamin D, consult your doctor and request a blood test, or try taking a vitamin D supplement. Number 5, increase in illnesses or infections. Many vitamins and minerals are known to help the immune system operate properly, and vitamin D is no exception. It is hypothesized to increase the generation of infection-fighting proteins by immune cells while decreasing the inflammatory response of white blood cells. Your immune system may be underperforming if you are vitamin D deficient. This implies you may be prone to diseases and infections such as the common cold or flu more frequently than normal. Number 6, back pain. Because vitamin D is important for bone health, a shortage of it may cause back discomfort. Furthermore, vitamin D has been found to have anti-inflammatory properties and may help to minimize muscular pain after exercise. So, if your back has been suffering for no apparent reason, try taking a vitamin D pill on a daily basis to see if you see any difference. Number 7, depression. According to research, vitamin D insufficiency may be related with an increased risk of depression or may worsen pre-existing depression. There is also suggested to be a link between seasonal affective disorder, SAD, and low vitamin D levels. If you have any indications of depression or seasonal affective disorder, such as a prolonged low mood or a loss of interest in your usual activities, you should consult your doctor. Taking a vitamin D pill may benefit you in the long term, but depression is severe and should not be attempted alone. Number 8, decreased wound healing. Have you noticed that minor wounds and grazes take a long time to heal? You might be suffering from a vitamin D shortage. A study discovered a substantial link between low vitamin D levels and difficult-to-heal lesions. Consult your doctor if you have a wound that is not healing. While a vitamin D deficit might be to blame, it's essential not to jump to conclusions. Slow wound healing might also indicate an infection, poor circulation, or diabetes. Number 9, hair loss. Hair loss can be caused by a variety of factors, including a lack of vitamin D. In fact, a recent study discovered that low vitamin D levels in males may be related to the severity of androgenetic alopecia, male pattern baldness. Because beauty originates from inside, ensuring adequate amounts of important vitamins and minerals, including vitamin D, is critical for maintaining thick, luscious hair. Number 10, muscular pain. Chronic muscular soreness and weakness can be difficult to diagnose, and it's an issue that many of us face as we age. Vitamin D levels also tend to decline as we age. Evidence shows that there may be a link between chronic pain and vitamin D insufficiency. According to one study, vitamin D supplementation dramatically reduced the intensity of growing pains in youngsters. If you have unexplained muscle discomfort, you might try taking a vitamin D pill for a few weeks to see if it helps. Number 11, weight gain. Some studies have revealed that persons who are overweight or obese had lower levels of vitamin D, raising the possibility that a lack of vitamin D may induce weight gain. However, the evidence supporting this is minimal. Weight gain happens when you consume more calories than you burn, and the only method to shed weight is to consume less calories than you consume. However, taking a vitamin D pill is beneficial to your overall health, so there's no harm in experimenting to see whether it helps with weight control. Number 12, anxiety. Anxiety is one of the most frequent mental health issues, with over 8 million individuals in the United Kingdom suffering from an anxiety condition at any given moment. Researchers have discovered a possible relationship between vitamin D deficiency and anxiety, with one research discovering that taking a vitamin D supplement may reduce anxiety. Everyone feels anxious from time to time, but you should see your doctor if your anxiety is bothering you more than normal or is having a substantial negative impact on your life.